record. Okay, we're recording. Hi, everyone. I'm Dr. Susan Blum, and today is Vaccine Q&A Part 2. A lot of you were with me a month ago when I did a Q&A for you. Basically, I'm just hopping on here to answer questions as best as I can. I read everything. I read medical, my subscribed medical journals and things that come in every morning. And so I think I'm sort of up to date on pretty much, the recommendations. And as most of you know, I'm also have a very active medical practice, and I focus on chronic disease and inflammatory diseases and autoimmune disease, as well as anything. I'm really a generalist in functional medicine, but I have a lot of experience with inflammatory and autoimmune conditions. And so a lot of questions about that too. So you listen, so welcome back. A lot of you are here for the second time, I know, because you sent me all your questions. So Lindsay in my office got 8 pages of questions. And so what I did was so the first thing I want to say, in addition to welcome, and you all know I'm Susan Blum, is that I'm not going to answer your medical question. And so this isn't medical advice. So you have to understand, like, some of you sent me in questions that had like a paragraph of, here's exactly what's going on with me, exactly what should I do. And I just want you to know that I am going to address your question, but in a more general way. This is not medical advice. I cannot give you medical advice on the internet and like this. And so I just want you to know that I am definitely going to be giving my recommendations, but it's going to be more in the context of in groupings. Like if you asked specifically, for example, about your specific kind of allergy, I will be talking about allergies, okay? And maybe making a reference to some people ask these questions, but you're not going to hear necessarily that I'm going to answer your question specifically. The other thing I want to remind you all is that I'm recording this, and I am going to be sending this out by Sarah will send out the email to all of you who registered. We have your email address. So I'm going to send you out an email, and there'll be different things that we talked about here, but there'll be information in there in addition to the recording. And so, for example, I'm not going to review today my general recommendations for the vitamins and supplements you should be taking to, in terms of keeping your immune system strong. But I still have my blog on our website where I wrote all about that, and there'll be a link to that in the email to remind you. So that kind of thing. So tomorrow, or maybe tonight, depending on when Sarah does it, but probably tomorrow, you'll get the email, look for it with this recording. Okay? All right. I doubt that I'm going to get to your question. So I'm going to keep doing this once a month. If your question didn't get answered, remember to send it in. And in the email we'll send tomorrow, we'll remind you how to send in your questions for the next vaccine webinar. I'll do another one. I'll do this once a month, and we'll just keep having a conversation. And a lot of the questions are the same questions I answered last time, which is fine. In some ways, probably, the nuances of, and the new J&J, so a month is a long time in the world of a COVID pandemic. And so questions there's different sort of second versions of similar questions. And then there's new questions that will come as we're beginning to venture out, or a lot more people have a vaccine, and there'll be a lot more questions about that. Okay, so if you don't have your question answered, all of you sent them in advance in some version. I sort of think I'm going to answer your question, but for those of you listening who still have a burning question, save it, and I'll have to answer it next time if I didn't answer it this time. Okay. All right, so here's what we're going to do. I went through all the pages you sent, and I grouped all of your questions into 4 main categories. So just keep in mind, I'm going to work my way through these categories. The first category is, just about the vaccines. Just remind you all want to be reminded about the differences between the 3 vaccines, and you're all, I would say a large chunk of you listening, just who haven't gotten a vaccine yet, they just don't know. It's like, which one should I get? I have this health issue, I have allergies, I have I'm nervous about, this is new, this is not new, which one should I get? And so um, I'm going to talk a lot of, probably the first whole half of our talk today. Our time together is going to be just about the vaccines, the differences, effectiveness, what that means, and which one, and what we know about the different ones, with some sort of ideas about how to choose. The next thing we'll talk about after we go through all of that is specific health conditions and vaccines. Again, like, which one should I get, or should I even get a vaccine? And there was a lot of you who wrote in about that. There were all sorts of autoimmune folks. There were people who had transplants and low complement and thrombocytopenia and like low blood cells of various kinds. And, and Hashimoto's, and a lot of just people wondering, what should I do? And so that's going to be its own little second section that we're going to do. With that also is, after the first shot, I had a flare of my symptoms. Now what? Do I get a second shot? So specific health conditions and issues, and like what to do regarding the first or the second shot. So that's going to be part 2. And that includes those of you with the allergy questions, of which there were a lot of you. I hope I'm going to be able to answer all your questions to your satisfaction. And then we're going to wind up with sort of not as many questions on this, and it's not as big a topic, but also like people wondered, are there alternatives to vaccines? How do I prepare before and after? Side effects, prophylaxis, treatment, after the vaccine, what should I take? So questions about that. And then at the end, we'll wrap up with, after, like, people after vaccine or after COVID, people with long COVID, long haul COVID, after you're vaccinated, now what can you do? And so hopefully we'll have time to get to that. But that's sort of the last whole grouping of sections. So I took all of your questions and I sort of put them into, it seemed to me they all laid out into one of these main sections. And so your question is going to be answered with the people who asked similar questions. All right. So let's jump in. So there are 3 vaccines. If it's not approved here, I'm not reviewing it. Next month, if AstraZeneca or the Novavax or any of those are approved here, and you even have to worry about it being a choice for yourselves, I will review them. But there's no reason to review them now. It's not one of your choices, okay? Right now, you have and actually some of you wrote in saying, how do I have a choice? How can I figure out where to go, where I can choose? You might not have a choice. And, as Anthony Fauci says, and so does all the public health people who are really good at what they do, as they say, in general, unless there's a health consideration, which we're going to go over today, you should just get whichever vaccine you can get. I am still pro-vaccine. I'll just start out by saying that. In general, I'm still pro-vaccine. I'm more concerned about you getting COVID than I am about you getting vaccinated. I'm fully vaccinated. I got Moderna. My husband got Pfizer. And my whole health team, most of us got Moderna. And Moderna and Pfizer is sort of the mix, because really that's what's been around. But really, I'm much more nervous about the risk of having the virus running amok in your body, and the damage that it can do, and that we know that it does. And so I'm still very pro-vaccine. I'll start out by saying that. Now, I do understand that, so the 3 vaccines, Moderna and Pfizer, and those are both messenger RNA vaccines. The third one on the block now is Johnson & Johnson, and Johnson & Johnson it's called a vector virus vaccine. And so let me first start out by saying that none of the vaccines have COVID. Okay, you hear me again? You cannot get COVID from a vaccine. There's no actual virus in there, okay? But in my last, I don't really want to spend a lot of time explaining how messenger RNA technology works, but I'm just going to say very quickly that the RNA vaccines have just a little strand of, they have RNA just is it's not your full genetic material, it's the messenger. It's a separate strand that's not your DNA, but it's an intermediary strand that helps direct the cell to make a protein. And so you take the messenger RNA vaccine, there's a strand in there or multiple strands, that go into, and it's in a fat capsule, and you get the vaccine, it goes into your body, into your cells, and the cells, and then it starts making, it doesn't go into your nucleus, it doesn't hijack your cell's DNA, you don't become a chimera or any kind of hybrid organism. The messenger RNA stays in your cytoplasm, which is the outside part, not in the nucleus of the cell, and starts making its protein, which the cell releases into the bloodstream, and you make antibodies to it. And in general, the spike protein, it's very specifically tailored to the spike protein, which is the part of the coronavirus that causes it to attach to the cells and become the most contagious. That's how it infects the cells. And so scientists determined that the spike protein would be the best one to make, the best part of the coronavirus to make antibodies to. Now, that being said, and of course, I'm going to end up telling these things out of order, because as I get going, I just sort of tell things. We know that there are variants. So what does it mean when there's a variant? The spike protein, the virus itself can change a little bit. And so the protein that that the Pfizer and the Moderna vaccine is making to the spike protein might not be exactly, the spike protein of the virus, of the new variants, might not be exactly a perfect match to the antibody that you're making, because it changed a little bit. I'm going to come to that a little later towards the end, and I'm going to talk about variants. I personally, I'm not worried about them. I mean, I don't want to say there's nothing at all to worry about variants. Sure, there's like possibility of variants becoming a problem, but in this moment, I don't believe that the variants are a big enough problem for us to lose sleep over at this minute. Okay, right now the vaccines are effective enough against the variants. All right, variants to come, we don't know, but right now the antibodies that are generated by the vaccines do a really good job against all the illness that we're seeing in our country. Okay, so I'm going to come back to more detail about that. Just bear with me. I want to come back to the different kinds of viruses. I have a lot to say about that stuff. It's not easy to keep all this organized for you, okay, because you have a lot of different kinds of questions. All right. So the first thing I want to say is, so I was telling you about the different kinds of vaccines. Moderna and Pfizer are the messenger RNA. Now, some of you have concerns about the fact that it's a new kind of vaccine, and that is true. We haven't had this vaccine that we can say 2 years from now what might happen, okay, that we might see some effect of this as some issue in years from now. We only have 3 months, and we have millions and millions and millions of people who have gotten these vaccines in these 3 months, and it actually looks really darn good. Really, in the history of vaccines, definitely there are some side effects we'll talk about. There are some people there's some side effects that are worse than others, but in general, these vaccines have proven to be super safe, okay, for what we know. Now, in the medical field, my colleagues, we talk about this thing called the unknown unknowns. Let that sink in for a second. There are unknown unknowns, things we don't know that we don't even know. And is that possible? Okay, I have to say, sure, that's possible. But so far, in December, my friends and I my functional medicine colleagues, we were sort of all in a discussion thing together, and we're all talking about, but what about the unknown unknowns? Okay, now we're 3 months in, and a lot of our unknown unknowns are being answered about the short term, and so far, so good. But for those of you who are concerned that there's no long-term history using these kind of vaccines, I would say that there's probably not a good argument for you about that. And if you really are concerned about that, then let's talk about Johnson & Johnson. So Johnson & Johnson is the new kid on the block. This is a different kind of vaccine. It uses the same technology has been used in the past. Like that's what's used for influenza and other vaccines that everyone's been getting all these years. The technology is called a vector virus. And all this means is they take a part of an adenovirus, so a different kind of virus, not the coronavirus, but it's called an adenovirus. And they take a part of an adenovirus, and they attach it to, they take the spike protein that we were talking about that's used in the RNA viruses. They take the spike protein or the sections of DNA. Now this is DNA. They take DNA from the COVID virus, really the DNA that for these proteins for the coronavirus, and they merge it with the adenovirus. So basically, The coronavirus hitches a ride into the body on this other adenovirus. They're inactivated, so they can't cause illness. There's not enough of COVID in there to cause COVID anyway. So it's just a tiny piece of the coronavirus gets attached to the adenovirus, and the adenovirus is the vector that then comes into the body, and then it triggers an immune response. And so adenovirus vector vaccines, which is what this is, Johnson & Johnson, have been around for years and years. And so we do have some history. And so for those of you who are really worried about like this, something about the messenger RNA virus makes you nervous, then get the Johnson & Johnson. The only way out of this pandemic is to get vaccinated. And honestly, I know there are people who don't want to get vaccinated. So the only way out of the pandemic is to get COVID or get vaccinated. Let me clarify that. There are a lot of people who aren't worried about getting COVID, and there are very low risk people, the people that are younger, that are lean and not overweight, the people with the high risk of the obesity and hypertension and cardiovascular disease, that whole grouping of people, diabetes, if you're high risk, it's a crapshoot to get COVID. Right. So you're either going to take your chances with COVID or take your chances with the vaccine. People who are very low risk and younger might choose not to get a vaccine and take your chances with COVID. And, that's really your prerogative. I'm not going to argue with you. That being said, though, there's a reason to get the vaccine as as part of being part of a community. And that's what this whole conversation is about, doing it for your family, doing it for those around you, doing it for your community, because in order to slow the spread of the virus, we need more and more people to end up immune. And you'll either get immune by getting COVID or you'll get the virus. You'll either get COVID, the virus, and you'll get sick, or not too sick, but you can get COVID, or you can get vaccinated. And so then we move towards this thing called herd immunity, which everybody talks about. And what I want you to understand about this herd immunity, and all it means is that the community as a whole becomes immune, and there's some magic percentage of people who have antibodies in order for that to happen. It's not a black and white thing. It's not that all of a sudden the community is going to have a huge surge and then they're going to be completely protected. It's like a dimmer switch. I saw somebody say on TV, which was fabulous. It's like a dimmer switch. Right now, for the past year, the lights have been bright, and the virus has been raging through the community because there's all these virgins in the community, virgin immune systems who haven't seen this virus before. As more and more people either get sick or get vaccinated, the dimmer goes on, and the lights get dimmer, and the room gets dimmer, and the surge slows down, and the amount of raging, burning through the community slows down because there's less virgins to infect. And so if you choose not to get vaccinated, then you can contribute to the spread and giving it to someone else if you get sick, and you're taking the chance of getting sick. So I respect anybody's decision, but just be aware that this virus is not going anywhere, and it's going to keep circulating in our community really until everybody gets sick or everybody gets vaccinated, or we reach that magical number, which we think is about 80% of people are either have had COVID or are vaccinated. I think it could end up being lower than that. And there's all sorts of other kind of mathematical models, which we're not going to get into. So I think it's going to be lower than that. I think we're already seeing it starting to slow down. And I think we're going to continue to see it slow down with getting everyone vaccinated at this point. So that's I sort of digressed a little bit about herd immunity. I want to come back to, though, which is where I started, about the reason that you want to get vaccinated. It's for yourself, because getting COVID, there are plenty of young folks who have died. Getting COVID, there's a little bit of a crapshoot. You just don't know. My 25-year-old who's healthy and strong, and he's strong. He's got no health, and he eats healthy, and he takes some vitamins, I guess. He listens to me sometimes, and takes his vitamin D, And he got COVID and he was really sick for, I would say, 5 or 6 days, like really sick. Of course, I gave him everything I could, and he took everything. I ran over to his apartment and gave him everything. But I spent a lot of days there worrying about, oh my God, is he going to go to his lungs? Is he going to get pneumonia? Is he going to go to the hospital? And so, you just don't know. And so I can just say that now that I'm vaccinated, I just feel the fear has left my body. I'm not afraid that I could die, that I could get get sick and die. So that's again my pitch about getting vaccinated. So let me help you figure out how to get vaccinated. And that's really the purpose of the rest of this. Okay. Now, so Johnson& Johnson has been around longer. And so that might ease some of your minds if you want to do a vaccine that you trust the technology. Okay. The only people who are contraindicated or shouldn't get Johnson& Johnson are people who have an allergy to any of the ingredients. Okay. And it's the same thing for any of the other vaccines. And so I want to encourage you to go on the CDC website. It's like cdc.gov/coronavirus. And you can find, it's all in the left column. It's like very easy to find. And there's links. You find the vaccine ingredients for the 3 different viruses. And if you're a person that has allergies, if you have an allergy to any of them, you should not get that vaccine, even if it's a mild allergy. So now, Moderna, and they have other things, and not just so we talk about PEG, which is polyethylene glycol, which is in both Moderna and Pfizer, and polysorbate 80, which is in Johnson & Johnson. And I know one person wrote in that she has polysorbate 80 and she thinks it crosses over to polyethylene glycol. I'm not sure about that. I believe they're separate food, like sensitivities and allergies, but really the CDC says that even if you have a mild reaction to those things, if it's an ingredient in the vaccines, you should not get that particular vaccine. So there's a big difference. There's polyethylene glycol in the RNA ones, and there's polysorbate 80 in Johnson & Johnson. I looked up when I made my list of the ingredients in Johnson & Johnson. They call it the Janssen vaccine also. It's the same thing. It has, it expresses the spike protein, which is what I said, citric acid monohydrate, trisodium citrate dihydrate, ethanol, 2-hydroxypropyl beta cyclodextrin, polysorbate 80, and sodium chloride. What it does not have are adjuvants, okay? And so here's for my autoimmune folks. One of the big things that concern us about vaccines in general, especially for autoimmunity, is that a lot of vaccines come along with mercury or aluminum to nudge and annoy your immune system so that your immune system will really get fired up. And none of these 3 vaccines have adjuvants. And so that's really good. I'm not positive, but I'm pretty sure AstraZeneca or Novavax, one of the ones coming is an adjuvant vaccine. And so the good news about Johnson & Johnson, it still has no adjuvants. But I invite you definitely can get the ingredients for the different vaccines on the CDC website, and make sure you're not allergic. And a severe allergy is one where you needed an EpiPen or your tongue swelled immediately. You had any kind of hives or itching or anything from when you're exposed to this ingredient within 4 hours, you have some sort of reaction. And so even a mild allergy, no. If you have to both polyethylene glycol and polysorbate 80, you probably want to talk to an allergist. I'm not going to give you medical advice to go get that shot. That's where you might want to make an appointment with an allergist and help them figure out what you should do. Okay. So let's talk about side effects of the vaccines. It's really interesting, actually. The one with the most side effects was the one I had, which is Moderna. Moderna seems to have the most side effects: fever, chills, headache, and 60 to 80, 60% after the first shot, 80% after the second shot. I will tell you that I had a little headache and chilly after my first shot, not really mild on Moderna, but my second shot, I actually did have fever, chills, and a headache. I had the fever and chills for 4 hours on the day afterwards. And so that's a lot, but then you get through it and you're done. Pfizer looks like it's mostly just headache and fatigue, and it's in 50 to 60% of people. And then Johnson & Johnson actually has the least side effects. It's only it's between 15 and 30% for very mild, like headache and fatigue, and there wasn't even a big fever and chills for Johnson and Johnson. So for those of you who had a huge flare or a huge reaction after the first shot of the other dose of the other vaccines, and you're afraid to get a second shot um, of the same RNA vaccine, very interesting that I read that, so you have the option of pushing out the second shot to 6 weeks. Once you go past 6 weeks for Moderna or Pfizer, there's a recommendation in the medical sort of wherever it was I read it, but I was really surprised that I read this and it was sort of good, that if you go past 6 weeks, you actually would qualify to get just the one shot Johnson and Johnson later on. And so for a bunch of you wrote in that you were really concerned that you had a flare in your, somebody had a flare in their MS symptoms, somebody had a flare in their facial Bell's palsy, sorry, and had a flare in their RA symptoms. And so it's interesting because I do think sometimes you flare in the way that's sort of what would happen to you if you got COVID, right? But if you flare your illness in a way that you're really concerned about getting, or you have a severe side effect or an allergy to the first shot, you have the option of waiting longer for the second shot, and pushing it to the end, to the limit, or just not getting the second shot and waiting even longer and then going back and getting the Johnson and Johnson. They don't have data about efficacy, about, your protection. But the thing is that I really do believe that everybody needs a second shot of some kind. Everybody who hasn't had COVID. I think if those of you out here who have had COVID already and you're wondering about the vaccine, I actually think it's sort of interesting. People that have had COVID and then get the second shot, have had COVID and then go and get their shot, often have side effects like it's a second shot, like bigger side effect than usual. And so in some ways, I wonder if you've already had COVID, if one shot is all you're going to need. And so that being said, if you're a virgin and you never had COVID and you go get your first shot and you're really worried about the reaction you had and whether you should get a second shot of that same vaccine, I would say that there's some discussion about people that letting it go longer, and that you would be eligible to go back and get the Janssen vaccine at a later time to give yourself that distance. We don't know how long your immunity lasts after one shot. A lot of people wrote in, do I really need a second shot? Do I really need a second shot? And the answer is, and one person said, do you need the second shot just because it's for longevity or for that extra 10%, And I'll say to you, yes, it's that extra 10%. And yes, it's the longevity, because we don't know how fast your antibodies go away if you don't get the booster. So I do think anyone who has never had COVID that starts the vaccine series, you need a second shot. The timing of that second shot and which second shot it should be, I think there's an opportunity for discussion there for you. I can't give you medical advice about that. I'm only just saying that I have read suggestions, and I'm suggesting for my people that have, concerns to wait the full 6 weeks. If you had a reaction that you're worried about having another reaction, to either wait that full 6 weeks, and we discussed this, or just wait until you're past the 6 weeks and later on in another month or two, you can get the Janssen vaccine, because the Janssen vaccine looks like it has less side effects. And so in the data. And so it just might, and maybe the fact that, and we'll talk about effectiveness in a second, but the fact that the body's familiar with the vector, which is the adenovirus, that it comes in on the adenovirus, and there's just a little piece of it that's COVID, that familiarity might cause the body not to have as big an immune reaction, which is maybe why it's maybe 10% less effective than effective at causing mild illness, or any illness, than the other vaccines. But it's also then it doesn't cause as big side effects, which for those of you who really don't even want to get a vaccine because you're worried about side effects, that might be a really good trade-off. And so that's what I'm starting to think, that the milder side effects, it's sort of worth the trade-off for those of you who are really worried about flaring or having flaring your condition, or having another big, or like that you had a big side effect from the first one, or you're worried about what might happen with the second shot. All right, so let's see where I was in my list of questions. We talked about a little bit of anything I see that somebody asked me. Yeah, so as far as I know, no one has died from any vaccine. Now, yes, there was a doctor who died of an autoimmune low platelet disease, ITP, thrombocytopenic purpura. And so those are in the Pfizer, Moderna, in the RNA world, right? That was from those vaccines. So, but no one has died directly from getting a vaccine, and we're not even 100% sure that the vaccine caused him to get that. Okay. And so there's no deaths from vaccines. So somebody said they saw that people had died. I haven't read that. Now, there might be somewhere, but there are the millions and millions of people are getting these vaccines. And is there a chance that somebody has an underlying condition that will cause a serious side effect? Of course there is. But considering how many millions and millions and millions of doses are going out with these vaccines now, we're not seeing this in big numbers. And we're still only talking about the one doctor in Florida. I mean, that's pretty good, that we're just talking about the one doctor in Florida. So that being said, if you have any concerns about platelets, or when you read about, definitely the platelet thing was, several of you wrote in and said, I have low platelets, or I have a blood disorder. You might want to wait for the Johnson & Johnson, right? That has not been reported. And so again, we're back to, if you're worried about this one, go for the Janssen. And I keep saying Johnson & Johnson or Janssen's the same thing. Somebody asked about Gilliam Beret. Gilliam Beret, none of the vaccines seem to cause Gilliam Beret beyond what is the statistic for the general population. So it doesn't look like there's an increased rate of Gilliam Beret. That's an autoimmune, that's actually known to happen from like the flu vaccine. Like other vaccines can cause it. All vaccines have that. This one does not cause that any worse than any of the other ones. Okay. All right, so I want to talk about so that's just the different vaccines. I want to switch gears a little bit into a lot of questions about immune response, like antibody response, T-cell response, antibody, innate adaptive immunity. I'm not going to get too big into this, but what I want to tell you some exciting news. Okay, I want to just point out that up until now, we keep talking about checking someone's antibodies to see if they're immune. And one of the things, when somebody comes back negative, you might hear your doctor, you read, and people say, well, maybe they have T cells. Maybe their immune response is not antibodies, it's T cells. So here's the immune system, right? The immune system, think about the immune system like your military, right? This is your defense system. And there are different kinds of soldiers, and there's different divisions. And one of the big divisions is the two first big divisions, and somebody asked this question, is the innate immune system and the adaptive immune system. Every vaccine, COVID itself, every virus is triggering your innate and your adaptive. All this means, innate means it's innate. It like responds right away. It's more non-specific, but these are these natural killer cells. We call them the NK cells. They come out of your bone marrow and they're just circulating and they attack like anything that looks foreign. It's not like a guided missile, right? It's just a general, blow up the whole world kind of thing. It's not, we call it non-specific. So innate immune system is ready to defend you, even not even being sure of what the virus is. It'll just defend against all viruses. Over the next few weeks, after being confronted with a new infection, your immune system starts adapting and it starts making guided missiles. It like specifically targets that infection. And that's why it's called adaptive. It adapts to the details of the new infection. The adaptive immune system has two main soldiers. And those are the ones we're really talking about measuring here. It has T cells, which is like hand-to-hand combat, and it has B cells, which make immunoglobulins, which are antibodies. Think of those as guided missiles that are shot from like the soldier. The soldier shoots this guided missile, the antibody, it circulates and it gets the bad guy, at a distance. The T cells are hand-to-hand combat cells. They directly engage the virus and try to clear it from the body. And so up until now, and so all the vaccines trigger all these responses. They trigger you get innate response, adaptive response, you get T cells, you get antibodies. Okay, that's the first question. Quite multiple questions that were about that. The second question then was about, the second part of that is that about testing. And I'm here to give you like breaking news, which I read yesterday, which is like so darn exciting. Microsoft teamed up with a biotech company to create a T cell test. And it has like machine learning and AI, and it's this great new test. It's not out yet or completely available, but it will be soon, where you can actually measure your T cell response to COVID. So you can check and see if somebody had COVID based upon their T cells and not just about antibodies. Because we suspect, and maybe you suspect, that you were really sick last December, but you never tested positive because our testing was so bad. And it's possible that your antibodies, you had it and your antibodies went away, but there's memory T cells. And so we're getting better now. Our testing is going to be so much better in the coming months. We're going to have T cell testing. And there's a new, I actually can order this now, a lab called BioReference that I have an account with. It's just like LabCorp request. They sent us a whole memo that they now offer 2 antibody tests, and one is going to be able to detect the spike protein antibody from the vaccines. And like one will be for like if you had COVID, and one is going to be vaccine specific. And so we'll be able to measure your antibodies. And so there's really good testing coming, which sort of brings me to the next sort of topic, which I guess I'm skipping down to this part because it just sort of follows. There's a lot of you who ask questions about, I have autoimmune disease, or I have, a transplant, or I have reasons why I'm on immune suppressing medicine. Should I get the vaccine? Can I get the vaccine? Is it going to be effective? And really the answer to that is that when you read all the data and the recommendations, every one of you is recommended to get the vaccine, and that it apparently is still effective. Whether or not you reach the same target numbers, we don't know. Like there's not enough data, but you are going to make antibodies. And trust me, some antibodies I think are better than no antibodies. And T cells, we will be able to measure that soon, right? And we will be able to see if you go get a vaccine, we'll be able to start you'll be able to get the test for yourself, and we'll be able to get the data really looking at, people on these medications and what kind of response they make. The one category of medication that seems to be really troublesome the most is prednisone. And for those of you who are on prednisone, that's more of a problem. And here's why I think this is. Prednisone is a global immune suppressor. So prednisone shuts off all the soldiers. It just is equal. It just shuts everything off. And so it's hard for you to make an immune response. All the other medication that people are on, like the medication you might be on for autoimmunity or rheumatoid arthritis or MS or even colitis or transplant, a lot of these other medication target one particular soldier in your immune system, like one particular sort of inflammatory molecule or immune molecule or a soldier. And so if that medicine is suppressing that, I already just told you that the vaccine is going to trigger T cells and B cells, which make antibodies. And so if you have one that's suppressed, the other one can get to work. And so I think that's why it appears that most all medications are really fine. If you're on any of them, still go get your vaccine. It's really just prednisone that's I think the most troublesome. And so therefore, I am telling people, if you're on prednisone, especially if you're on more than 5, I really think probably any prednisone, the less the better. Definitely above 5 milligrams of prednisone is really a problem. You probably, I don't know if maybe only 1 or 2 milligrams would still be okay. We have no idea of the data. But in an ideal world, getting yourself off the prednisone, maybe going on to one of those other medications if you need to, would probably be better for you in terms of the chances of eliciting a good antibody response. That being said, and you can you can get tested after you get your vaccine, because definitely the antibody test is out now. BioReference has it, and most doctors can order from them. And so the antibody tests are out now. The T cell test, I don't know when that'll be out. Man, that's fascinating. And knowing the way the company is sort of working on it, I think it should be soon. Okay, so let's see. I talked about side effects in general and specifically for each one. All vaccines cause the same immune response, and the side effects that people have, I think, does perhaps have to do with the ingredients of the vaccine. We don't know how long immunity lasts. People ask me that, which is again what I said about why I do want you to get your booster shot or a second shot at some point, because it will help keep your immunity. And by the way, I anticipate we're all going to need booster shots. I think at this point, we only know the vaccines have been being studied since September. And so I think that I'm expecting that I'm going to need a booster in the fall. And I think that's fine because they're tweaking the shots now to fix them for the variants. And so I actually anticipate in the fall, like next year, before the winter maybe, we might all be going back for a booster of some sort, especially if the variants really start, kicking our butt a little bit. Vaccine efficacy. All right. So this is the big, elephant in the room about, I don't want to get the Janssen vaccine because it's less effective. So I spoke to this already a little bit. Pfizer's. So let's just talk about what the words effective mean. Pfizer, 95% effective. What they say is that it prevents illness. So 95% of the time, it prevents you from getting sick. Right? It doesn't mean you're not going to get infected, and we're going to talk about that in a second, like carrier state and all that. But 95% protection against illness, which means you tested positive for the virus and you had like one of the significant symptoms, like fever, shortness of breath, cough, one of the main constitutional COVID symptoms. And so it prevented you getting that sick in 95% of people. 7 days after your second shot, fully effective. Moderna, 2 weeks after your second shot, it was at 94.7% or something, but pretty much close. And the same thing, preventing you from getting really sick, not severe illness, but sick, ill, fever, cough, the whole thing. And so fatigue, down and out, sick, all right? And so it prevented that. And that's the Pfizer and the Moderna. And with that comes pretty big side effects. All right, bigger for Moderna than for Pfizer, but definitely side effects for a lot of people. The majority, 80% of Moderna people second shot had one like big side effects: fever, headache, something. Okay. Johnson & Johnson, their statistics, and here's the thing: Pfizer and Moderna did their testing when there were no variants around, like none. And so they tested on the original sin, the original coronavirus. And that's what they made their vaccine for. So our data and the data they're giving us, this 95, 94%, it's for against the original coronavirus in the studies they did last year, okay, or whenever it was, they were doing it last spring and summer. Johnson & Johnson, however, they tested their vaccine against the current, they came 6 months later. So their vaccine that they're testing already has a mix of variants in the population. So it's not really apples and apples. Their vaccine is really looking at the effectiveness against, they did a lot of testing in Brazil and South Africa. Actually, in South Africa, they were down to, it was 62% in South Africa. But in the US, and right now we have a mix of variants. We have a mix. And so their data sort of is in the current mix of variants, or although probably there's even more variants now than there were before, but they had a 72% prevention of any illness at all, right? The illness that we're talking about, just fever or cough, and 85% protection against severe illness, which means being sick enough to go into the ICU. Okay, 28%, 28 days after the shot. Both vaccines, all the vaccines so far have prevented, no one has died from COVID after getting a vaccine. And so they all seem to be nearly 100% effective at preventing death. That's pretty darn good, you know? And so you see, there's like, we don't know whether Pfizer and Moderna are still as that effective they're still at 94, 95% in our current state with the variants. I would say the Johnson & Johnson vaccine is more real time about what's really happening. And the good news, and I really think we should focus on the donut and not the hole, you know, like focus on the good. The vaccine prevents you from dying from COVID, and it prevents you from overwhelmingly 85% of you Janssen, probably, we don't know if it's still that high, the 95 in Pfizer, from going to the ICU. And so this is really, really, really good news. And so, which is why I think that everyone should get vaccinated. And from my view, especially talking to all of you who have all your concerns about your own illnesses, your own medication, you know, everything that you're going through, your reactions to the first shot, your allergies, your concerns about flaring your own disease from the RNA shots, it looks like the J&J is less has less side effects. And as long as you're not allergic to polysorbate 80 or anything in there, it might be a better choice for you, and it's still really, really effective, and would still be better than getting COVID if you have any of those health issues. So a lot of you asked, do I need to get a second shot? I already answered that. I talked about herd immunity already and the dimmer switch, and I talked about variants. So far, so good. Okay, and the testing the boosters. Okay, that's that whole first section. Before I move on from just general vaccine stuff, I do want to say that there are people still asking, like, can you help me figure out how to get a vaccine? I don't think that's really, I can't really help you with that. It depends on where you live and what state. They're all different. I will tell you that what we discovered amongst my team and my family and friends, depending on where you are, like some people had no problem going on, you know, when their eligibility came up. But a lot of it is timing, like when you go online. So for example, CVS and Walgreens, they're doing the over 60 crowd here now in New York. They lowered it to 60, but they're doing the older folks. And actually in Connecticut, they're doing also healthcare workers. So CVS and Walgreens sort of updates their systems and adds the new appointments at midnight every night. And so sometimes it's in the middle of the night, it's 1 o'clock. So wait a minute, was that the midnight folks? Yeah, some do midnight. I think Walgreens was doing 7 a.m. So I got this tip that go on right at 7 a.m. and that's when all of a sudden, lo and behold, 6:59, I'm like refreshing, and at 7 a.m. all the new appointments came in. And so most people have a lot of luck between midnight and the morning, right? So a lot of the systems are putting in their cancellations, updating new appointments, and I think you're going to have less and less of trouble getting vaccines. So you can go through the CVS, Walgreens pharmacies. You can go through the hospitals. If you are in a hospital system and you're a patient, you can try to get in. The hospitals are really focused, though, on healthcare workers. But New York State, I know, and then you go to your state website. And how do I get a shot? And you just work at it and you'll get one. It seems to be getting easier and easier. People are figuring this out. Okay. So moving on, see, we have 10 minutes left. So specific health conditions and vaccines. This is my next section, but I actually already talked about this. I talked about the autoimmune folks. I don't want you to get one with an adjuvant. So far, the 3 don't have mercury or aluminum, and that's good. All the different health people. Let's see, I'm just looking at my list. Medication and the effectiveness. I told you about that already. Flare after the first shot. Yes, somebody wrote in about Bell's palsy and MS, and we talked about that. Consider getting waiting the full 6 weeks and then getting Johnson & Johnson. Hashimoto's is not a high risk for COVID, and you can get a vaccine like anyone else. Same thing if you're pre-diabetic. These are people who wrote in specific things. We talked about allergies and checking the ingredient list, and you should only avoid that vaccine if you're allergic or have really it's an allergy, if you have an allergy to anything on the list. Yeah. And if you're not sure, then you talk to your allergist or talk to your doctor. And if you had an allergic reaction after the first dose of the vaccine, don't get the second dose until you talk to your doctor, and you can talk to your doctor about switching. Somebody asked a question about pregnancy and childbearing and what we know about kids, and I don't have an answer for you. I don't really know, but there are studies now being done. They've been recruiting for studies for women of childbearing age, and trying to it's very hard to get pregnant women to agree to do the vaccine, although maybe not because they're pregnant now and they're concerned. So, um, there's definitely a lot of, I know of a pregnant woman who had COVID and actually ended up in the hospital. Didn't need a respirator, but needed oxygen. She had COVID pneumonia and she's come out of the hospital, is doing good. Her baby looks okay. So, but we need to know more and more about that. And I actually don't have any advice about vaccinating kids. This is just all the brave new world that we're still waiting for that information. Okay, so moving on then to the final two sections, which the one people asked about, do I really need a vaccine? Are there alternatives? Can I get, is there like a prophylaxis or something else I could do? And this really just brings us back in 1 second. This really just brings us back to questions about, is there anything you can take to prevent COVID? Even getting COVID instead of getting vaccine. And so far, there's nothing that's been, no studies that have proven anything. Two specific questions. One was on ivermectin. Now, ivermectin is a deworming medication. I will tell you that I have one of my dearest best friends is Mexican, and she lives in Mexico. And, she lives in Mexico City. And, they are giving out ivermectin like candy for everybody. The second you have symptoms, you take ivermectin. I have colleagues who have had a discussion about, I've seen posts and discussions about this ivermectin. And so I was really happy to see that a group there was a PubMed article where there's a randomized placebo control study looking at ivermectin and whether it decreased the length of your illness or helped or influenced the illness in any way. And it looked like a very good study, and it didn't look like it had any effect. And so that came out a week or two ago. And so I guess, this has been all the buzz, ivermectin, and so we're now getting data about it. And so far, the data doesn't look good. It's sort of like Plaquenil, which is the hydroxychloroquine. The data still doesn't look great for that. And so my answer, if you're asking me, and I'm just giving you my medical opinion, I would say no to ivermectin. I would say no to hydroxychloroquine. And the questions were regarding prophylaxis, like for prevention instead of a vaccine. My answer is the same even if you got COVID. I'm not seeing where that's really helpful. There is some new antibody therapies that are, monoclonal antibodies. And so there was some great study that came out last week, which was an injection. It's like a one-time injection of a mix of these different monoclonal antibodies. It like stopped COVID dead. And so we'll see if that really turns into something. And so I think our treatments are getting somewhere, but no to ivermectin and no to hydroxychloroquine. No to aspirin and baby aspirin unless you get sick. So my 25-year-old, he's got no health issues. I gave him baby aspirin. I brought in my bag of all my stuff as soon as he had his positive test. I live in an hour north of New York City, and he has an apartment in the city. And he quarantined in his apartment. I left everything in bags outside his door. We waved to each other from the pinhole of his door. It was sort of very sad, actually. But I brought him bags of stuff and soup and, me, Jewish mother that I am. And, but I went by my office and brought him, his whole table was filled with supplements, but he took everything. And I did give him baby aspirin. And so if you get COVID, I think a baby aspirin is a good idea. Actually, my cardiology friend suggested 2 baby aspirins, which is 81 and 81, which is 162. I don't think you need a full aspirin, but it just keeps the blood from clotting. And you don't know if you're going to be a person that's going to be hypercoagulable state, which means you're going to throw blood clots. And that's one of we call it sequela, or one of the bad things that can happen if you get COVID. In terms of prophylaxis, yes to vitamins for preventing COVID. And in your email tomorrow, I'm going to remind you I have a blog all about vitamins. And And so, um, and so I'm going to switch then, still in this list of questioning is, can I prepare for the vaccine? How do I prepare for the vaccine, and should I stay on all my vitamins? And the answer is stay on all your vitamins. Yes, it's okay to take liposomal vitamins. See, there's so many specific questions you sent me. After the vaccine, Tylenol is okay. No non-steroidal anti-inflammatories, so no Advil. We don't want to suppress the immune response. Tylenol will just help you with, and here's the thing, like fever from a homeopathic perspective, fever is thought to it's your immune system like doing its thing. And so if you can manage the fever, I wouldn't necessarily take Tylenol for the fever. I had to take Tylenol because I had a wicked headache. Oh my God, I wouldn't have slept if I didn't take Tylenol. So I did take Tylenol for my headache. But that would be the one to take as opposed to Advil or other non-steroidal anti-inflammatories. Somebody asked about homeopathic Physica vaccine tox or something. I love homeopathy, and actually I had my favorite homeopathic doctor who was a good friend of mine. She's been treating COVID patients like crazy, and I had her do a consult with my son, and she gave him homeopathic remedies the whole time. And so he did do homeopathy, and I really do think he got better very rapidly because of it. Now it could be all my vitamins help, but and so definitely if you know a homeopathic physician and they're treating COVID and you happen to get it, that's good. If there's a homeopathic for like helping you after a vaccine, I don't think that would hurt, but I don't really know. And then for those of you who tend towards allergies, there is a little protocol that we've been doing for people who tend towards allergic. If you're a little high-V, and that's not a reason not to get it if you get it from other things like food, you can still get your vaccine, but you might want to pre-medicate with Pepcid. So it's Pepcid at 20 milligrams. So the day before the vaccine and then the day of the vaccine. Pepcid, Zyrtec, and vitamin C, I would say 500 to 1,000 milligrams. You're probably already doing vitamin C like that. So just stay on whatever your vitamin C dose is. But a little H2 blocker like Pepcid and Zyrtec are thought to, that's circulating amongst myself and my colleagues. Whether it's really a thing or not, I don't know, I've been telling people to do it. I did it. I don't know that it helped me that much, but I didn't really get much after actually I did it after my second vaccine. And I still had a bad reaction, but what I had was not an allergic type reaction. It wasn't a histamine related thing for me. It was more true vaccine stuff. It was headache and fever and chills. And so if you're concerned about an allergic type reaction, we recommend that you can pregame with Pepcid, Zyrtec, and vitamin C. Okay, in my last little section, in my last few minutes here, post-vaccinated, post-COVID, now what? Okay. So if you've been vaccinated and you're 2 weeks after your second shot, you're considered to be vaccinated. And the question is, what can you do? And the question is, can you get infected and can you be a carrier? And the answer is yes, you can get infected. And all that means is you could end up with COVID in your nose. You will not get sick from COVID, but there's all these terms that are being used to sort of, these terms are being used that are, the meaning are for people who were vaccinated and got exposed to COVID and might become a carrier, meaning it's in your nose. You can be infected, meaning it's in your nose. We don't know if you're contagious yet. We still don't know. It doesn't look like it. It doesn't look like you're contagious. It looks like maybe there's just some COVID in your nose. It's enough to just be detected by a COVID test, but it's not enough to make someone else sick, and you don't get sick. And so that's called like a carrier state, or it's more about, it's actually a carrier is somebody who I think are more like could potentially get someone else sick, although maybe not. So I would say, yes, you can get infected, but you can be infected and never get sick, which is really what we think is happening. So people who are vaccinated, yes, you can end up getting infected, but we don't know if you could carry it and infect someone else, which would be contagious. But we know you don't get sick, and that's the most important thing for you. And so a lot of questions were about like, who can you be around now? And you can see the CDC gave guidelines for that. And my interpretation of this is, I had my first like get together with my friends who we were all vaccinated and we're out from our 2 weeks, and they came over for dinner. And that was so darn exciting. And so you can be without a mask in your house with a small group of vaccinated people. Now, if you want to be around people who are unvaccinated, and only a few, now we're talking about small groups here. It's still only like 8 people or 10 people. We're not talking about a big group. Anyone who's unvaccinated coming into that group, if you want to not wear masks, they have to be like one family group, right? Like a bubble. People who have been careful, they've been in their bubble. If you want to be around them and you've been vaccinated without masks on, that seems to be okay. However, somebody wrote in, and it's a good example for everybody else. Kids want to see her. She's high risk and she's been vaccinated. They would fly in, and they have not been vaccinated and don't plan on being vaccinated. Her children and her grandchildren, like this family unit, would fly and come to her house. And she's really uncomfortable with it. And I would say that's fair, because they could definitely, from their even if they were quarantined at home or they've been in their bubble, travel is risky, which is why, like in New York State right now, you come in on a plane, you have to quarantine or get tested. When you have to have a testing protocol, or you have to quarantine when you come in. And so what I would say to people who want to, so in that kind of case where somebody flew or they're coming to visit you and they were exposed in their travels, you are either going to wear a mask, or have everyone still wear masks in the house, but let them come over, but you can wear masks or at least for a period of time. They can all get tested after 5 days. Let them come for 2 weeks. So that way after 5 days, you can get tested, or after a week, they can get tested. And then the second week, you're all good. But it's possible that there is the 5% where you could end up not protected. And so I think you still have to be a little bit careful. And so that's my answer. That was a very specific question somebody asked, but I think that helps for all of you. My son and his girlfriend are not vaccinated, but they're in a bubble, and they're either at her apartment or they're here. And so we let them come into our house. We're all vaccinated here. We let them come over without masks on. We're all walking around. And so, but we know their bubble, and so we're all doing that. I told you about the new testing. And then the very last thing I'm going to say in our last, I'm 2 minutes over. I just want to mention about long COVID, because some really interesting thing, and long haul COVID, people who've had COVID who have had symptoms for a really long time, and they're really nervous about getting vaccinated. And there's all these reports now coming out that people with long COVID get a vaccine and they actually get better. And so there's 3 theories about this. We don't really know what long COVID is. We think long COVID could be there's still some persisting virus in your body. It could be that you have some pieces of virus in your body that are not alive, but they're still sort of annoying your immune system. Or you have some autoimmune activity. And the theory is that by getting a vaccine, the immune response, it bumps up your immune response. It clears out any residual virus. It clears out any pieces of virus. And if the problem with long COVID is autoimmune, then it sort of distracts your immune system away from targeting your tissues to just attacking those proteins in your blood. And so if you're someone with long COVID, I would invite you to talk to your doctor about it. But from what I'm seeing, if I'm feeling really comfortable about people with long COVID getting a vaccine. And so that's the end of my thing. I actually got through all your questions. You see how many questions you all sent in? And I understand it's a really big, this is just a huge topic. I'm aware that some of you, there's a whole bunch of questions you guys put in. I'm not going to be able to answer them. But what you can do is we can add them to, so please, I'm not even going to, once I turn this off, I'm going to see if I could find the questions. Sometimes they disappear. But for my next Q&A, feel free to send in your question, and you send it in, and we'll give you that information. Look for the email tomorrow from Sarah, and she will send you the information for how to submit a question for next time. Most of you figured that out because, like I said, I had 8 pages to get through. And I think I got to most of yours. Some of you had very specific questions that I wasn't going to get to. The other thing I want to leave you with as we're wrapping up, and we're getting ready to say goodbye, is that at the end of the day, and you will know this because I've been preaching this for those of you who've been following me all these years since my first book came out in 2013. Um, I'm a big, 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 big proponent and teacher and advocate for like resiliency building and healing the immune system, and having just improving the functioning of your foundations and your foundational systems in your body, and helping improve immune function in general. And so the core of that is the gut, and the gut and the immune system connection. And then taking after that. So in my book, The Immune System Recovery Plan, it's the 4-step program, right? It's food, it's stress, gut microbiome, gut health, and lowering your toxin load. Okay. The 4-step program. And so I'm always on our online programs, or our online, we're always working to help support you in helping you work your way towards just really optimizing those 4 systems in your body: your stress system, your stress and your hormones, eating right, having a healthy gut, and having a low toxin load. And I'm always helping to support you in that work. And now it's just as important as ever. Now it's just as important as ever. It's even more important that you keep working to keep your immune system healthy. And so in the email tomorrow, I'm going to give you some tips and some ideas for, like I always do, what we're doing at Blum Center, what we're doing online, and also just some ideas for how to strengthen those systems. Oh, excuse me, I think I inhaled something weird. It was floating in the air. So on that note, gut health, we're really focused on gut health at Blum Center for the next month. So we'll share some information of that with you. And look for the email tomorrow, and there'll be more in there, and you will get this recording. So stay well. I hope you can use this information. You'll send in the questions for next month, and we would just keep going. Hopefully some of these won't coming up, because it means you understood what I said this time, but it's very confusing, so I understand if it will. Take good care. Happy spring. The little tips of things are starting to come up outside in my house. And I remember when I was sitting here a year ago in my home office, and out of my window, I was watching the crocuses and the daffodils come up. And a whole year now, I'm going to be sitting here and watching it come up. But I have plans to open Blum Center. I'm reopening my office in May or June, and I'm really excited about that. So for those of you who follow me or who are patients or in the area, look for all of our correspondence about that. So we're going to have a big reopening. I'm very excited. So I'm very optimistic about the future, and I hope you are too. Get your vaccines. I hope I guided you to help you choose the right one, and I will talk to you all soon. Have a great weekend.